I've been seeing periodontists all my life, and looked around and when I moved up to the Bay Area, I had actually lapsed where I didn't actually find a periodontist that I liked or was in the vicinity. Needed some work done, and I also wanted to find a periodontist that was cutting edge, wasn't kind of the old school. So we have a symptom where we get some bone loss. That was the first thing. So prior to coming here, I was always getting deep cleanings like every few months. And then I had stopped once I moved up to the Bay Area from Los Angeles. And then I needed to get it done again according to my dentist because he couldn't clean that deeply. It was to the point where the pockets between the teeth were not able to be cleaned by regular instruments, nor was it able to be cleaned by my dentist as well, nor myself through regular flossing. And that's just something that I genetically inherited from my parents, and so you needed a good eye on it. And so she recommended a procedure that, through the laser treatment, also helped the tissue regrow and the bone regenerate a little bit, but also allowed her to clean really deeply as well, and allowed me to reduce the pocket size so I can floss. I will note that one of the procedures that she did after consulting with a previous periodontist who didn't do it was laser treatment, and I've recommended that procedure as well as Dr. Kaeley to everybody I know that needs it done. It's absolutely fantastic. The pain and the recovery was far less than some of the procedures I had done with periodontist when I was younger. It was actually painless. The procedure itself was painless and significantly reduced healing time, which is great. I was still able to do other things versus have a ton of gauze in my mouth and just be incapacitated on a couch for a week. So it was good. It was for a period of time I started getting a toothache in the bottom left molar area. I had a condition which is called resorption. It doesn't happen too often, but I was having extreme pain in my tooth, and I actually called Dr. Kaeley from a trip I was taking saying I'm in extreme pain. She prescribed some painkillers until I was able to get in the office, used some sophisticated technology to do a CAT scan or CT scan in a way. Was able to look at the tooth and see that I actually had what's called resorption, which is basically the teeth is decaying away internally and it's getting to the root. And she said you have to get it extracted right away or you're going to go through extreme pain and it might spread to other teeth. So did it. She did it. I was concerned because I hadn't had a tooth extracted since I was a kid, and she did it without a hitch. It was fantastic, and the healing went well, and she prepped my area to actually have an implant done as well. She's like my sister in a way now. We're very similar in personalities, very candid. She's extremely knowledgeable, very gracious. We like to bounce ideas and experiences off each other, but from a professional standpoint, she definitely knows her stuff. It's evident by the technology that she uses, that she's always up to speed with new procedures, new techniques to ensure that patients have a good experience and then also get excellent results as well.